Welcome to those of you who have joined today's webinar. I'm Maria Williams with the Collaborative on Health and the Environment. Change is bringing you the latest in environmental health science through a partnership calls and webinars, science serves, publications, and social media. I would like to welcome everyone to today's partnership webinar, which is titled Superstorms and Superfund Sites, Preventing Toxic Exposures from Climate Change Disasters. Our moderator today is Dr. Wendy Heiger-Bernays, Research Translation Core Leader of the Boston University Superfund Research Program. We will leave time following the presentations for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentations. After the presentations, our moderator will read out questions for our presenters to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 60 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Wendy.
Thank you, Maria. Welcome. This is the 18th call in a series that is co-organized and hosted by Collaborative on Health and the Environment and the Boston University Superfund Research Program. The Superfund Research Program is a multidisciplinary program with centers around the country, each conducting and communicating research with the goal of breaking the link between exposure and disease. The centers are funded by the National Institute of Environmental Health Sciences, and this research program is truly unique in that it has always emphasized solution-oriented multidisciplinary approaches, research translation, and community engagement. CHE is a partner on the BU Superfund Research Program's Research Translation Core. On each call, we highlight work being done at one or more centers across the country for CHE's membership and listeners. One of the efforts of the BUSRP is our focus on sharing technologies, tools, and models with broad audiences. As Maria mentioned, actually, I don't know if she did, we will send you a very short evaluation survey after the call, which will help us tailor future calls to your interest. Please take the 2 to 3 minutes to respond. After my brief overview, I will introduce each speaker who's asked to speak for about 20 minutes. Their complete biographies are located on the CHE Call website if you want to know more about them or you want to contact them. We will then engage in a discussion that will be guided by questions from you. So please come forward with questions during or at the end. Thank you. So let's begin. Okay, we are experiencing the effects of climate change. Changes in temperature, increasing numbers and intensity of storms, as we on the East Coast sit here in the third of the nor'easters in the past 10 days, sea level rise, drought, and desertification. In the US alone, last summer saw forest fires and resultant mudslides in the West, changes in growing season and drought in the center of the country, and blizzards, nor'easters, and hurricanes in the South and East. In fact, here we are, and we hope not to lose power again. As a result of these climatic changes, public health impacts, some of them due directly to storms and forest fires, such as increases in respiratory diseases due to mold and forest fires, and rates of people displaced from homes and homelessness due to flooding and destruction are occurring. More sustained effects due to changes in temperature, including heat and cold stress, increases in vector-borne diseases, use of pesticides and associated poisonings and discharges to water supplies are straining public health capacities. As with other public health issues, the greatest impacts are being observed in low-income communities of color and tribal communities. The objective of this call is to share information on 2 efforts to plan for and to prevent situations that perhaps we previously hadn't appreciated. These were experienced in Texas, in Alabama, and in Puerto Rico during and following hurricanes this past fall. During these events, communities experienced explosions that released hazardous chemicals from industrial facilities and release from inadequately secured storage facilities and from Superfund sites. People can be exposed to these contaminants directly in the floodwaters, in the air, and some may remain on the ground after floodwaters recede. In Puerto Rico, a groundwater well at a Superfund site was used for drinking water where no other source of water was available. I note that our SRP colleagues at Texas A&M and Northeastern are working in these communities. Okay, now that we're all discouraged, let's not give up. In addition to attempts to decrease the rate of climate change, we need tools and achievable adaptations to decrease the impacts on the public's health. During this webinar, our panelists will discuss community prevention plans and policies that can help protect human and environmental health, and with a specific focus on hazardous wastes for when the next disaster strikes. Without further delay, let's hear first from Dr. Anna Hoover, who's an assistant professor in the Department of Preventive Medicine and Environmental Health at the University of Kentucky, a communication scientist with expertise in health and risk communications. She serves as co-core leader of the University of Kentucky Superfund Research Center's Research Translation Core. Dr. Hoover is also co-principal investigator and deputy director of the Robert Wood Johnson funded National Health Security Preparedness Index Program Management Office, which oversees annual production of the index, an important tool for better understanding U.S. and state-level preparedness to address large-scale public health threats, the topic that she will share with us today. So thank you, Anna.
Thank you, Wendy, and thank you, Che, and to the BUSRP for inviting me to participate in this conversation that I think is so important as we map strategies to prepare for the kinds of large-scale events that we've been seeing in recent months and years. It does seem a little strange to be having a conversation about climate in the midst of the third nor'easter to folks who do not quite get the difference between weather and climate. Obviously, weather is what is happening now, and climate is our long-term trends. And the climate really drives a variety of large-scale extreme weather events that Wendy referred to, including nor'easters, including flooding, including droughts. And we can look at the long-term trends in climate in a number of ways. But recently, just in the last month or so, NOAA has issued a report that I think the folks on this call will find really interesting, looking at the climate and recent disasters. And as you can see here, the data from 2017 are in, and most of the country is much above average for temperature when compared to the period in the 100 years preceding, 120 years preceding. And we also have pockets of the country that are really in the record warmest territory for last year. So what this leads NOAA to talk about is how 2017 was hot and disaster filled, and there is no unlinking those two items. So when we think about long-term trends in climate, when we think about what the impacts are in the long term, we want to look at some of the data. And this particular data is from that NOAA report I just mentioned. And it illustrates that in the last 6 years, we have had among the top 10 costliest years for disasters. And those disasters have ranged everything from severe storms to tropical cyclones like we saw last year. Obviously, wildfires have been on the uptick. Winter storms last year was not too bad, but this year I think you guys are well aware that we are in the process of experiencing an uptick there for 2018. So I think it's important to look at these data as we look at the climate data and think about what the relationships are there. Just last year, from a more qualitative standpoint, we saw the impact, some of which Wendy referred to at the top of the call, when we saw concerns in Texas that Hurricane Harvey had washed contaminants from a Superfund site downriver. We saw a lot of damage related to those kinds of issues. Our colleagues at Texas A&M are engaged in testing of those sites. I think Jennifer Horney is leading some of that work. We had the privilege of speaking last month on a different call, and I hope that Jennifer will be able to join you all soon to talk about that work. So we saw the 1, 2, 3 punch. It wasn't just a 1-2 punch. First, we had Harvey. And then we had Irma bearing down on Florida. And as Irma was coming ashore and we weren't sure, was it going to be a Category 4? Was it going to be a Category 5? Where were we going to land there? There were headlines about EPA trying to secure toxic sites because we were just coming off of Harvey. We had just seen concerns about some of the contamination related to that. Then after Irma, we had Maria in Puerto Rico, as Wendy alluded to, and we had the citizens there were drinking water from a well on the Superfund site. Following all of this, a lot of interest was raised in the popular press and in the research community really about hazardous waste sites and how those hazardous waste sites are going to be affected by long-term climate change. AP did a study and reported on it in December of 2017, finding climate change risk for more than 300 Superfund sites. There are about 1,700 national priority list Superfund sites. So this kind of data, learning that these sites are at risk for flooding, for other kinds of risks related to climate change, has really pointed some in the media to point to a real toxic waste hurricane problem that we have. And I think we've seen that play out in the last 6 months or so. So why do we have this specific toxic waste hurricane problem? Why are we thinking about this in terms of hurricanes? Well, when you look at this map of Superfund national priorities list sites, about 1,700 of them, and you can see how they're clustered along coasts, especially in the Northeast there, the Gulf Coast, Florida, these areas that we are so accustomed to seeing in the South and in the Gulf Coast there, where we are accustomed to seeing a lot of hurricane activity, have a lot of Superfund sites. And then as you move up north into North Carolina and Virginia, and then you get into the Northeast where you are not without the effects of superstorms like Sandy just about 6 years ago. So we have a lot of risk along these sites for what can happen when there's flooding, when there are high winds, how exposures related to these sites could be increased in these communities. Before I talk too much about Superfund, and as Wendy mentioned, one of my hats is working with our Superfund Research Translation Corps here at the University of Kentucky. I like to give folks a little bit of background about the legislation that really drove Superfund. And I apologize to those of you who are familiar with this, but I just want to quickly touch base for those of you who might not be. Superfund really arose around 1980, following Love Canal, following a number of Valley of the Drums in Kentucky, following a number of different incidents as the Comprehensive Environmental Response Compensation and Liability Act in 1980. And what it did was it really established liability of potentially responsible parties to help clean up those sites. And it authorized US EPA to head up some of the activities related to recovering those damages. And it also created the Agency for Toxic Substances and Disease Registry at the Centers for Disease Control and Prevention. Then about 6 years later, it came time to reauthorize the Superfund law. And in the meantime, some things had happened. And among those issues were a number of cases where communities were either unaware of the risks they were facing or not able to be involved in planning for those risks. And if you look to the right of your screen there, you will see that one of those events happened in Bhopal, India, when methyl isocyanate was leaked into the community. The communication systems were inadequate. Folks didn't really know what they were facing, and thousands of people died, and tens of thousands of people were sickened, and many are still very ill today. 30 some years later. So it's really important, it becomes really important as we're thinking of this reauthorization in 1986 to think about how can we prevent those kinds of situations from occurring. So in addition to passing the Superfund Amendments and Reauthorization Act, or SARA, we do like our acronyms in environmental health. In addition to thinking about SARA and increasing state involvement in Superfund programs so that there's more localized control over some of these issues, and increasing the focus on human health by funding the NIH Superfund Research Program that Wendy and I are both involved in ways in our own communities. It came with SARA, the Emergency Planning and Community Right to Know Act, or EPCRA. Yet another acronym, but EPCRA was really important because it solidified and codified this need for communities to be aware of the risks and involved in planning to prepare for threats that may arise from the risks that they are facing due to different kinds of facilities and contamination in their communities. So it set the requirement for local and state emergency planning. It established local emergency planning committees, or LEPCs, to begin working on emergency plans for different kinds of facilities. And it also importantly established a right of public access to risk information on chemical hazards in communities. So Sarah and EPCRA in 1986 really laid a lot of the groundwork for some of the work that's still going on in Superfund today. Now I need to take off my Superfund hat for just a moment and put on my National Health Security Preparedness Index hat, because I want to pivot from this discussion of Superfund sites and the risk related to them to think about capabilities. So we've talked just a little bit about threats related to the placement of Superfund sites. I want to talk a little bit about capabilities. With the National Health Security Preparedness Index, we are really monitoring the capabilities in states and across the nation for dealing with large-scale health events. And we do that in a number of different domains, including things like health security surveillance, community planning and engagement, healthcare delivery, and importantly, one of the areas in which we look at what are our capabilities statewide, in states and nationally, for dealing with large-scale health threats. We have an environmental and occupational health domain. And this map that you see before you exemplifies the distribution of environmental and occupational health protections across the country from the 2017 release of the index. Now, there will be a new release next month, but from the 2017 release of the index, you can look at this map and get a sense of where states are in terms of the capabilities that the index measures. Now, the index does not measure exhaustively environmental and occupational health. In fact, a lot of what it looks like, a lot of what the index looks at in this domain relates to what extent the public health laboratory, the state public health laboratory, is conducting or assuring specific kinds of lab testing. So what kinds of contaminants are being tested for, what media are being tested, and does the state public health lab have an important role in that testing? So you can see here that there's a wide variation, and there are geographic pockets, as there are in all maps of disparities in several of the same places that you would expect to see. For example, the southeastern United States, Region 4 in EPA and CDC terms, and the concern there is that some of those states are among the most likely to be hit by hurricanes, and yet they're performing below the national average. In addition, what we found is that since the first release of the Health Security Index, more than 40% of all states have seen declines in their total score in their environmental and occupational health protections. So in the last 5 years, we've seen almost half of the states decline in the area of environmental health protections. And it's not just states that underperform across the board. There are about 17% of the states that perform in the top tier of overall health security are still below the national average in environmental health protections. And more than a third of those top tier states have experienced declines. And again, those sticky geographic disparities are concerning, because the top scoring state in environmental and occupational health scores almost 2.5 times higher than its lowest scoring counterpart. So we have disparities in terms of who is prepared and how prepared they are. We have seen concerning decline. So what we wanted to do was start thinking about what are some of the potential drivers for these findings? Well, what might be driving variation? What might be driving declines and improvement? And we looked across the index for other indicators that were not in the environmental and occupational health domain, but other indicators that we could sort of map to these scores. And in our incident management community planning area, we had this measure of whether or not a state has a climate adaptation plan. And we thought, well, a climate adaptation plan, a state with a climate adaptation plan theoretically should be performing better in environmental health protections, because these are issues that should be top of mind. So what we did was we looked at how many states had had climate adaptation plans. And what we found was only 15 states have finalized climate adaptation plans. And these plans are available on Georgetown's website, and I'll give you a link a little bit later in the call if you're interested in looking at these. But 15 states have finalized climate adaptation plans. And as you can see, those are clustered largely along the coast, which are the folks that you would obviously think would be most concerned about climate change, given the increased threat of hurricanes, severe weather, flooding, sea level rise. There are only 3 states in the interior that have climate adaptation plans, and Wisconsin is the newest and just came online, I believe, in 2016. So we said, okay, if we look at those states and we look at how they're performing in environmental and occupational health in the index, do we see any trends? All we saw was that states, coastal states with climate change plans, climate adaptation plans, were scoring about half a point higher overall on their environmental and occupational health scores. But then when we looked at all the states that had climate adaptation plans, we pulled those 3 non-coastal states back in that perhaps the climate issues don't seem as salient for. What we saw was a real moderation of that difference. So all of a sudden, where there had been a big gap in coastal states' performance in environmental and occupational health, all of a sudden, when we look at all states, it shrinks up and becomes non-significant. So we thought, why is that? Well, what could be different? They all have climate adaptation plans. And what we really started thinking about was, well, those plans, our measure really only indicates if a state has a plan. It doesn't tell you what's in the plan. It doesn't tell you what the quality of the plan is. It doesn't tell you to what extent it addresses anything. So we did some qualitative dives into these state climate adaptation plans. And what we found was it is a very heterogeneous mix of plans. Some of these plans were finalized as early as 2008. Some as recently as I mentioned as 2016. Most of the coastal states with climate adaptation plans, about 75%, had already finalized their plans by 2011. So this has been on their radar for a long time, those coastal states with climate adaptation plans. Massachusetts is one of them. And those plans have been finalized for a long time. They vary widely. There's no template for how to put together a climate adaptation plan. They really vary widely. In terms of length, we have climate adaptation plans that are 12 pages, and we have some that are more than 400 pages. So you can imagine the level of granularity, the level of whether you're talking about high-level concerns or concerns to be addressed, or whether you're really getting down in the weeds on strategies, really varies widely from adaptation plan to adaptation plan. Also, interestingly, we have this variance in terms of leadership. Most of the groups leading these climate adaptation planning processes have been governor-appointed commissions or task forces, and they have representation from a variety of agencies, a variety of different kinds of private and public stakeholders. Some of these plans have been put together by environmental agencies. The most recent one, Wisconsin, was put together by a state health agency. And then the collaborative roles involved in putting these together varies as well. So less than half of the steering committees, a concerning issue for those of us in public health is that less than half of the steering committees leading these efforts really included public health sector representation at all. So you've only got 15 states with plans, and 6 or 7 have public health sector representatives on the steering committee. Some of these also have stakeholder engaged processes that have task forces or focus groups, and there are sometimes public health representation in those groups. But again, as far as leading the charge, only a little bit less than half have public health involved in these climate adaptation planning processes. So how does that play out in terms of what are the goals and the strategies that we're thinking about in these climate adaptation plans? Well, when we look at the coastal states, and remember, those coastal states are outperforming other states in the index. When we look at the coastal states, they have about 13% of their climate adaptation plans are devoted to goals around public health. And then there are an additional 4% that are really looking at goals related to emergency preparedness. So clearly when public health is at the table, it seems that public health and emergency preparedness goals are being prioritized. Then when we look at non-coastal states, we see that emergency preparedness makes up about 1%, and public health only about 4%. So, so instead of representing 15%, 17% of the whole, you've got 5% of the whole becomes focused on emergency preparedness and public health. So what's in those plans? What do those goals look like? Those of you who are really concerned about how do we plan for climate adaptation? How do we plan for large-scale storms and other kinds of extreme weather events and other kinds of health threats that are linked to climate change? Well, some of the goals that are playing out in these plans include goals related to extreme heat and other extreme weather health hazards like flooding, like hurricanes, like tornadoes, increased violence of these kinds of and frequency of these kinds of events. We also have a lot of goals around surveillance of food, water, and air. Now, if you were listening earlier when I told you what a lot of that environmental and occupational health domain of the index relates to, you might remember that I said a lot of those are surveillance measures related to what public health labs lead, what activities they lead. So that makes sense. If these plans are looking at surveillance issues, then certainly we should be seeing improved scores in those states. You're also looking at issues of potential water scarcity and water quality. Vector control is a big issue. If anyone watched the Pandemic and All Hazards Preparedness Act reauthorization hearings recently, Lisa Murkowski from Alaska was talking about their concerns about climate-driven vectors appearing in Alaska that they had not seen before, and what kinds of vector control processes were being put in place. So we're looking at these vector control issues. So mosquitoes with Zika, carrying Zika or other kinds of disease are going to be in regions we're not used to seeing them. There are issues around smoke emergencies. Clearly, as Wendy mentioned earlier, we have vulnerable populations to be concerned about who live along floodplains very often and in other areas of concern, in areas closer to hazardous waste sites. There are preparedness planning goals, and then there are also issues around early warning systems, information sharing, emergency response planning. So just to give you an idea of what one non-coastal climate adaptation plan looks like, I just pulled up some quick numbers on Pennsylvania. And you can see that in Pennsylvania, when you combine emergency preparedness and public health, they comprise about 9% of the goals in their adaptation plan. So that's about in the middle of what I was describing earlier in terms of what those percentages look like in coastal and non-coastal states. These state adaptation plan in Pennsylvania was finalized about 7 years ago. And their public health goals include things like walkable communities and proactive planning for heat stress, flooding, and droughts, strengthening their environmental health tracking program, and improving their surveillance data and databases. In terms of their emergency preparedness goals, what they're saying is we need to include preparedness and response in future climate plans. I think the reason we see Pennsylvania in the middle instead of on the low end of percentage of goals comprised by public health concerns is that there was a public health steering committee rep. So this is one of those states that did have public health's voice on the committee. And they also included a public health and safety working group to further tease out the issues that were raised. So the implications are that there are existing data sources like climate adaptation plans, like the index, that can really help you in analyzing and prioritizing the climate-related vulnerabilities and capabilities in your state. The National Health Security Preparedness Index can really help with that climate adaptation planning piece by helping you identify where your gaps are. Where do you have strengths related to climate vulnerability? Where do you have gaps? And helping you track progress in filling those gaps over time. Because state climate adaptation plans are really varying across a number of dimensions, from length to content to leadership, it's really important to examine whether health goals are explicitly included. And to think about including public health expertise on those leadership committees for those climate adaptation planning processes and other kinds of long-range strategic initiatives to help make sure that the public health perspective is there to point out potential vulnerabilities that others might not catch, and to point out potential strategies for mitigating those vulnerabilities. I invite you to learn more about the index. Download your state's data. Here's a link. You can get to it on the PDF slides that have already been uploaded. You can go there and download your state profile and look down at the measure level at what kinds of capabilities you and the folks you're working with think are most important for addressing climate change. You can also, if you have a state that has a climate adaptation plan, you can download that on the Georgetown Climate Center website. There's the link for that. Once you go there, you can also find local climate adaptation plans. So if you're interested in knowing whether your city or one near you has a plan and what's in that, you can also access that information on the Georgetown Climate Center. You can also read more about this. And with that, I'm going to hand over, acknowledge my team and hand over to Wendy and Tiffany.
Great. Thank you very much, Anna. So now we're going to hear from Ms. Tiffany Skogstrom, who's Outreach and Chemical Policy Analyst for the Building Chemical Safety into Climate Change Resiliency Project at the Massachusetts Office of Technical Assistance. Ms. Skogstrom raises the agency's visibility as a free and confidential resource for Massachusetts toxics users and coordinates OTA's chemical policy development and research. Throughout her career, Tiffany has worked with various environmental and nonprofit organizations on waste reduction, recycling, and pollution prevention campaigns. She will share some of the work of the Toxics Use Reduction Institute that's doing to provide resources and strategies to industries, to municipalities, and to communities to understand and prevent releases of hazardous substances during storm events. So thank you, Tiffany.
Great, thank you, Wendy, and thank you, BU School of Public Health, and also Shay for allowing me to participate today. My name is Tiffany Skogstrom, and I work for a state agency called the Massachusetts Office of Technical Assistance, and I'm going to talk with you about some of the issues that our office is trying to address in order to prevent industrial accidents that are caused by climate change. So to give you a little bit of background about our office is we were created by the 1989 Toxics Use Reduction Act. And that is an act that's unique to Massachusetts, and it requires businesses that have more than 10 employees that use certain chemicals at a certain threshold to file with the states, pay a fee, and also every 2 years do a plan on how they are going to address finding safer alternatives and eventually work their way out of being in the TURA program. There are 3 state partnering agencies that help implement TURA. The first is the Mass DEP, which is the Department of Environmental Protection, and they are the regulatory agency. So they go out and they do the inspections at the facilities, they issue fines, they collect the fees. Then there's the more popular sister agency, which is the Toxics Use Reduction Institute out of UMass Lowell, or TURI, and they're more popular because they actually have grants that they can give to small businesses or industries to find safer alternatives, and to communities to help do pollution prevention community things. And they also have a lab at UMass Lowell, which they help industries try to find safer alternatives to chemicals used to clean parts. Then there's OTA, my office, the Office of Technical Assistance, and we provide the boots on the ground technical assistance. We actually go into the facilities and provide free and confidential technical assistance. We look at what they're doing, provide assessments, help them fix problems. Because we're confidential, that's actually written into the act. We don't tell when we find a violation. Instead, we try to help businesses fix that violation. And about 50% of the businesses that we work with invite us back. So we're chemists, engineers, and public health experts that provide a free second set of eyes versus having to pay to have a consultant come in and do those things. So we're a little bit unique. So right now we have a grant, and we're actually on our last round of trainings from the US EPA to incorporate chemical safety into climate change resiliency. So with this grant, we've been able to fund 10 different regional planning agencies to host 2 different types of trainings on chemical safety. The first round of trainings happened earlier this year, and that was with first responders and state and municipal workers on identifying toxic users and vulnerabilities in their community. So we then used that as a motivation to get those first responders to recruit people to our second round of trainings, which is actually with the toxics users themselves. So currently, now through April, we're doing trainings with toxics users on identifying their vulnerabilities and trying to prevent industrial accidents by showing them the resources. So the end goal is to incorporate toxics use reduction into climate change and emergency preparedness planning to reduce the risk of industrial accidents, which unfortunately we're seeing more frequently. So this is just an example of the type of toxics use reduction or industrial accident that we want to prevent. So this is the Arkema chemical plant explosion, or the results of it. These are refrigerated trucks that were exploded. And what was happening here is the company was using organic peroxides, and those need to be refrigerated. So when the floods came in from Hurricane Harvey, They eventually lost power. So they started moving these chemicals by truck up to higher lands to where there was still refrigeration available. And when the power went out and the floods got too high there, they had the workers start moving the canisters of these combustible chemicals by hand to higher ground until the fire department finally came in and said, nope, this is unsafe. You're putting your workers at risk. Everybody needs to leave before someone dies and this place is going to explode. So I would also encourage you, if this interests you, the Chemical Safety Board has a great short video on exactly what happened. But we don't want this to be part of somebody's emergency plan, that they're having workers actually carry canisters to higher ground as the solution. This is not a solution. So we worry about the workers, but also we worry about the people in the surrounding communities. So these are some of the voices through social media of the people who were trapped and sheltering in place during Hurricane Harvey. So it says here, there is a thick smell of oil in downtown. There's a widespread smell of gas. Any info? And rancid chemical smell near Houston. What's going on? Why all the flaring? Folks can't breathe. So this is really frightening to see this all play out. And this was all playing out as we were starting to roll up our chemical safety trainings with the first responders. And then there's also risk, of course, to the first responders. So these are the folks who actually have to go in when there is a fire and they risk serious bodily injury. So this is something that we don't want the companies in Massachusetts to be worrying about. We want to help them with prevention as climate change unfolds in front of us, as we see happening today. So when people think about chemical or about climate change, they're not really thinking about chemicals. They're thinking a lot about floods or sea level rise or that sort of thing. And we have seen that floods can result in spills and even explosions, right? So when people lose their power, they lose the ability to ventilate things, and that results in emergency shutdowns, which are dangerous. There's also the issue of extreme heat. So we see a lot of forest fires in California that are out of control, and chemicals need to be kept at a certain temperature in some cases, otherwise they're at risk of explosion. And then here we have extreme cold, which can result in infrastructure failure like frozen pipes, and HVAC failure or ventilation system failure, which could result in a buildup of chemical vapors and result in explosions or other things. And then general storms. We're seeing more and more storms that results in power outages. But if you think about what's happening in the Northeast in Massachusetts, we also have a lot of snow or rain that builds up on our roofs. And so that type of infrastructure failure can result in some accidents. So these are why we're doing what we're doing. So this is an example of industrial accident that happened in Massachusetts that was pretty bad. And it happened in Danvers, and it was called the Thanksgiving Miracle. Not necessarily caused by climate change. However, it was where there was a failure in the ventilation system, which can be caused by climate change, that resulted in vapors accumulating. There was an unknown ignition source. And you can see on the right that it was a pretty devastating explosion. And it was a miracle because it happened at 3 a.m. versus 3 p.m. So people were lying down in their beds and the debris from the explosion went over them versus kids getting off at their school bus at 3 p.m. where it might have been a different story. So nobody was killed, but there was lots of property damage. And this is the type of thing that really makes us think about what we want to avoid. So this is an article that was from the New York Times, and it outlines that floods are getting worse and that there's 250 or 2,500 chemical sites that lie in the water's path. So on the right hand, you see the Northeast where I am in Massachusetts, but these chemical paths or chemical facilities are everywhere. So this happened, this article, which is available online, is from early February. But before this happened, our office put together our own map, which is free for anyone to use. And actually, we would encourage other states or community organizations to put together a map like this. So this outlines toxics and vulnerabilities in Massachusetts. So we have toxic data layers, which include tier 2 facilities, which are where chemicals are used, stored, or released all over the United States. But again, this map is only for Massachusetts. Major facilities in Massachusetts that are toxic users, things like underground storage tanks or active railways that have toxics moving in and out of the community. And then there's vulnerability data layers that you can add. And those include flood and hurricane zones, environmental justice zones, high-risk dams, other vulnerable areas. But you can actually go onto this site and click on some of the data layers, and you can put in any address and see what's going on in Massachusetts. So this is something that we showed to first responders to help them identify some of the risks, but also we show to businesses so that they can think about how they're storing chemicals and some things that they can change. So to give you an idea of how this map can be used is these are a few different environmental justice areas in Massachusetts. So environmental justice in this map is identified by English as a second language being spoken in the community, low income, and a minority population. And as you can see on the map, there's a lot going on. So in the upper left, that's Chelsea Creek. And the little red dots are the tier 2 facilities. And those are the toxics users, along with the purple diamonds. The solid yellow and orange are meaning that it will flood in hurricane zones, different types of hurricanes. To the right, you see Fall River in New Bedford. So as you can see, that shows flood zones with large clusterings of toxic users. The lower left is Lawrence, Massachusetts, which is another environmental justice community. And you can see a whole bunch of high-risk dams along near the Merrimack River with toxic users. And then East Boston, which is where I live, and I'm here today, stuck in my house due to the storm. And I can tell you from experience, the last 2 storms, the water from the ocean was coming right up to people's doorways, and some of those doorways were toxic users. As you can see in the bottom, that's all flood and hurricane zones. So this is a map that other states could definitely put together, and we hope will be useful. So what our office does, and what people should be thinking about when they're looking at addressing climate change and chemical safety is this a dangerous chemical? What's the potential for human and environmental contact? And is there a potential for hazard? So as we're seeing with the more frequent and more severe storms, there is potential for hazard. There is potential for human and environmental contact. So our office comes in and we try to figure out how we can help prevent accidents like that. And we do that by evaluating risks. So we look at things like chemical properties. Is the chemical toxic? Are they flammable? And now we're looking at weather risks. Is the facility in a flood or a hurricane zone? Is there potential for freezing or heat issues? And then a lot of the interventions that our office has is with chemical storage. So is there secondary containment, meaning that if there's a spill, will it be contained before it's released into environment? Are the chemicals being stored according to compatibility rather than alphabetically? We find that a lot of people, they walk by how their chemicals are stored every day and they kind of miss things, and we offer a second set of eyes to come in and help them address that. And then again, we're all about toxics use reduction. So we try to recommend product substitution and reducing inventory and implementing engineering practices so that toxics can be sometimes eliminated. And sometimes we're able to do that, which is good. So this is an example of a case study that our office did. This is a company that we worked with. So this is Mark Ritchie Woodworking, and he's in Newburyport, Massachusetts, which is famous for getting hurricanes. So his facility is right there where the balloon is. And as you can see, the solid colors around him mean that they will flood in hurricane zones, in different category hurricane zones. You also might notice that there are little red balloons and purple and yellow triangles. And those are other toxics users that are really caught in the middle of that. So, so he did energy efficiency and toxics use reduction, and he's reduced by about 120 gallons of lacquer, thinner, acetone, and other chemicals per year. He's reduced down to, he's reduced by 1,200 gallons of denatured alcohol per year, and he's eliminated 12 tons of VOCs or volatile organic compounds per year, and he saved about $16,000 doing that. The other great thing about Mark Ritchie is that he is almost completely off the grid. So in his facility, he has a wind turbine outside. They use the waste from the woodworking facility to fuel a furnace that supplies hot water and heat to the facility, and he's got solar panels. So while his neighbors are using toxic chemicals and may, lose their power during storms, he might be able to continue working, and there's also less of a risk to releases during incidents. So here's another chemical victory that we did. So this is Ophir Optics, and they're in North Andover, Massachusetts. So as you can see, they have to the left of them is the Merrimack River. So that is in a flood zone. And they got a grant from the state to implement lean manufacturing and Six Sigma, which is a way of looking at producing things more efficiency. And they used it for toxic use reduction. So through that, they eliminated 3,800 pounds of mineral spirits per year. And they went from being a large quantity toxic generator to a small quantity toxic generator, which means that they actually didn't have to pay a fee to the state. They had a savings of $1 million in efficiency improvements, $100,000 in scrap reductions, and then $60,000 in hazardous waste reductions. So this is another example of how our office can help people. And then this is Columbia Manufacturing. And maybe you remember they used to make bicycles. They now make school desks and furniture that you'll find in schools. And they're located at Cycle Street in Westfield. So they did some wastewater reduction, and they were actually able to eliminate 147,000 pounds of water per day in their plating operations. And through that, they recovered 98% of their plating chemistry, which was nickel and chromic acid. So that saved about 600 pounds a week of using that type of chemical. And now they're exempt from air and water discharge permits and hazardous waste treatment permits. And they had a savings of $3 million in water and sewer fees, $3,850,000 in nickel purchases, and $8 million in chrome purchases. So they're in a flood zone again, and they're saving money and eliminating toxics. So, these are examples of opportunities. So we don't want to be all doom and gloom. We want to give people the tools and resources that they can to prevent type of accidents. And the goal is to really unite chemical safety and emergency preparedness together so that people are thinking about them when they're thinking about how to address climate change. So we're doing that here by offering OTA services to businesses. But we also want to make the businesses that we work with aware of other government agency resources. And we'd like to see businesses that are in the same neighborhoods and facing the same sort of challenges form business alliances so that they can help each other out and set examples of success stories. And then we don't want the trainings to end with our grant. We want this to be incorporated into local and regional emergency planning committee cultures. So these are the remaining training dates that we have for toxics users. We're supposed to have one in Leominster, Massachusetts this morning, and our climate change training was postponed due to climate change. That one will probably happen at the end of April. So these are the remaining trainings. We have all of our training dates and locations, and also all of our materials on our website, which is at the bottom of the screen. And with that, I'd like to say thank you. And if there's any questions, I'm happy to take those. But we would really like to see other communities use the tools that we have started to develop and make things better. And also we would take recommendations on what resources that people think that they need so that we can supply them and make sure that businesses and our partners in the state and local governments can have those. So thanks.
Thank you, Tiffany. There is a question, so we're going to take questions and our panelists will answer. One question is asked, are the OTA case studies available on the website?
Yes, yep. So we have case studies going back to 1989. So, and also if there are businesses watching that want to become a case study, we are actively seeking more and more examples.
Okay, great. So we're going to open up to questions and answer to questions. If anyone has questions, you can use your chat box for your Q&A. I'm going to start with some questions until others can post their questions. I'll start with Anna. Anna, can you provide one or two items that are sort of the low-hanging fruit, something that individuals or communities can do in preparation? You gave a great overview. We need to provide tools to to people. So what do you suggest?
Exactly. And I think it's a really interesting question because Tiffany had so many excellent tools to discuss. And when you're working at such different levels of granularity, the tools change. And working at the local and hyper-local level, I think that it's very exciting because when you're thinking about preparedness in the event of a disaster, in the event of an outbreak, our tiered preparedness system indicates that really the response is at the local level. Those are the first people on the scene and the last people to leave the scene. So we have to think about local level. But the index and these state adaptation plans I'm talking about are at the state level, the ones that we're looking at. So I think that it's important to identify what data will be most useful to you. I think that's really the lowest hanging fruit, is to do a kind of capabilities and vulnerabilities assessment with the data that are available, and then figure out what else you need. And those data may be an index, and maybe a state adaptation plan. They may be Trust for America's Health data or county health rankings data on vulnerabilities. It may be the Social Vulnerability Index, to be thinking about what kinds of infrastructure issues you have. Those are all interesting resources. And another way is to get involved with your local emergency planning commission, or with if you have a Superfund Citizens Advisory Board, to attend those meetings, to learn more about what they're doing and think about how you can contribute to the process, what unique perspectives you can bring to the table. I'm a big fan of collaboration. The people who are at the table drive the agenda. So you need as many perspectives to lead those discussions as you can, to make sure that you're not missing something.
Thank you. We have a number of questions. One question is, were Tiffany's cost savings each year, or are some of them one-time savings?
The ones in the slides that I showed were annual. Actually, some of them, I think Columbia Manufacturing had weekly savings, but that was measured in pounds of chemicals. But yeah, economically they were measured annually.
Great, thank you. Another question asking about whether nuclear waste or radioactive waste sites are being incorporated into the planning work. So first maybe Tiffany, and then Anna can address whether that's part of the indicators.
Yeah, unfortunately at the state level, I don't really have, our staff doesn't have the knowledge or experience with that type of waste. However, I think it could be a data layer that might be added to our map.
In terms of the radioactive waste, there are indicators in the Health Security Index related to laboratory capabilities for radioactive waste. In the adaptation plans, though, again, those are widely varying documents. Some of them are as short as a dozen pages. So we're not seeing a lot on hazardous waste. Massachusetts is actually one of the better plans in terms of at least recognizing and addressing hazardous waste concerns and noting that more planning needs to be done in the future. And in many of these state adaptation plans, it doesn't really surface. And if it does, it surfaces in infrastructure and not necessarily in relation to health concerns.
Thank you. Another question is, are there offices similar to OTA in more states than just Massachusetts?
I wish. We were created by the Toxic Use Reduction Act, which is the only one of its kind in the country, as far as I know. We do have agencies that do work with toxic businesses. Like I have a sister agency in King County in Washington State. And I believe in Minnesota, there's a similar agency, but none of them require the reporting or offer the type of confidential assistance that our office offers.
Okay. And another question similar to that, whether there are other places in the US that have an OTA kind of capacity, or are there federal resources for this kind of work that can make it more effective to do this work at the state level?
Yeah, it would be great if there were more resources. You know, we were able to do this project through an EPA grant. And so the funding is very scarce. You know, I think that what OTA can offer is, you know, we're developing a model that other people can use and borrow. It's all public domain. But I don't, other than the Minnesota and Seattle, Washington, I don't know of other agencies that are doing this yet, but they should. And they can use any of our public domain material to build on and make it better.
Along those lines, Tiffany, what are the greatest barriers that you see that prevent industries or communities from using the tools you described?
So to start with the first responders, when we did the trainings, you know, our first round of trainings, we heard from the folks in the fire departments and the police departments that they had a lot of difficulty understanding the tier 2 data, and that sometimes it wasn't compatible with, you know, the systems that they were using. And the tier 2 data is supposed to tell the first responders where the toxics in their community are used, stored, and released, so that they can actually find and you know, address accidents when they happen. For industries, they're supposed to be required to attend the local and regional emergency planning committees and councils. And what we're finding is that they are not. And that's actually like where they could get together with, you know, with the first responders and find state and local resources. So those are some of the barriers. And, you know, of course, we would love to do our trainings at these different LEPC and REPC meetings.
Okay, great. So is there room for input from individuals or local health professionals for tools and databases in the work that you do, or sort of more specific tools that people can access?
Yeah, you know, we would definitely love to find out what resources people need so that we could either develop those tools or make those tools available to our audience. The other tools that that I didn't present on are that would be great for communities is to look at the toxics release inventory where you live. If you just Google TRI where you live, it's an EPA site that will tell you where the toxics users are. Another great resource is echo.gov, or it's actually Enforcement and Compliance History Online. So that is an EPA map that shows you where there were compliance issues for toxics that you can look at in your state, anywhere in the country. And that's actually, I think it's echo.epa.gov, but just Google echo.gov.
Anna, if a community member, we're sort of going around and around, but what I'd really like to get at is, let's say that I'm hearing about this, I want to do something, I don't live in Massachusetts or King County, you know, what do I do about this and where can I go? I can see what I've got from these websites, which is great, but how do I get to the table?
I think that you have to identify who some of the people already working in those areas in your community might be. It might be your LEPC. It might be a subcommittee of your city council. Strangely enough, it might be, you know, it might be a local Superfund Research Center at a university or an environmental health sciences core center. There are also obviously CCTSs, clinical and translational science centers around the country at universities. So I would begin by looking for those gatekeepers to help get you to the table, because just showing up sometimes isn't quite enough. You need that introduction to the community. And if you can identify the folks who are already working on these issues, and you come to the table with some background knowledge that you've already gleaned and say, this is important to me. I think that we have to think about climate, and we have to think about the potential impacts on health and how we can prepare to reduce exposures that could be ramping up in these times. I think that finding those gatekeepers is really a critical step.
Okay, I think unfortunately there's two more questions, but our time is up, but we'll post these, I guess, online as well. Is there a need to standardize plans as the variation in planning seems large? And if so, is this being carried out? Anybody?
To my knowledge, in a federal system, it's sort of it appears to be every state designs its own process and designs its own outcome. And I don't think there's anything mandated top down. So not that I'm aware of. A great resource for learning more about those climate adaptation planning processes, though, is the Georgetown Climate Center. And they have all of that information available online, including the plans. So they probably have a better insight on that than I do, but I haven't seen any real top down efforts to standardize.
Yeah, and in Massachusetts, we have our municipal vulnerability program as part of the climate adaptation. And so that the state has been providing trainings on helping communities identify, what their vulnerabilities are. We've been invited by one of those communities to come in and help. When I say we, I mean OTA, to come in and help look at some of their facilities. But it's mostly individualized according to local needs.
Okay, I want to respect everybody's time and to thank our speakers and everybody who participated. I think there may be a few other questions coming in. Maria, can we address those online after?
Yes, we can actually send the questions to our speakers and they can respond by email.
Okay, great. Thank you very much. I request, if possible, you fill out the brief survey, and thank you very much.
Okay, thanks, Wendy. We are approaching the end of today's webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the recording, as well as to the survey that Wendy mentioned. CHE's next webinar will take place Wednesday, March 21st, and is titled The Obesogen Effect: Why We Eat Less and Exercise More but Still Struggle to Lose Weight, a conversation with scientist and author Dr. Bruce Bloomberg. You can RSVP through CHE's website, healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers for taking the time to present today, and Wendy for her excellent moderation. Thank you so much for joining us, and have a great day.